If you ever feel like you have a urinary tract infection, you should always get checked out. And actually, when you're pregnant, this can cause issues with preterm labor. So it's especially important to get checked out if you're pregnant and suspect that you have a urinary tract infection. However, it's kind of tricky because the most common symptom that pregnant women will have is contractions. So one of the first things we do if you come to the hospital and you're having contractions in your preterm is get a urine sample. And a urine sample can tell us a lot of things about what's going on, namely that you have a urinary tract infection or not. There's a lot of different results that will come back within the urine analysis, and the doctor will interpret those results and decide if you need to be treated or not. It kind of sounds like that's what your doctor's done for you. And you mentioned that there was leukocytes and blood in your urine. And those can be indications of a urinary tract infection, but if the numbers aren't high enough, then the doctor may decide that it's not necessarily time to treat. However, if you continue to have symptoms, you should call your doctor and they can always retest and decide if now you should be treated. Other symptoms of urinary tract infection could be you have to pee all the time, and when you try to go, nothing comes out. But that also sounds like pregnancy, so that's why it's really hard to distinguish between the two. You may have burning upon urination, or you may sometimes, in extreme cases, even see blood in the urine, but usually it's microscopic and you can't see it with the naked eye. Like I said, if you have any other questions, feel free to ask your doctor. Ask him if you feel like you need to be retested, if they'd be willing to do that, and chat with him about treatment options based on the results. I hope that you get feeling better and don't have any other issues. If you have any other questions, feel free to ask them on our Facebook page and recommend us to your friends and family too.